Hello, my name is Carlos Frick, and I'm the Communications and Advocacy Manager at NAMI Racine County, and your host today. July is National Minority Mental Health Awareness Month. This month highlights the unique challenges that ethnic minority communities face in regards to mental illness in the United States. In this episode, we're having a conversation with Sha'Boris Mays about these challenges, the role of stigma, and lack of cultural competency in this struggle, and more. Welcome to Compassionate Conversations, a podcast produced by the National Alliance on Mental Illness, NAMI Racine County, discussing subjects related to mental health and mental illness. Hi, Sha'Boris, and welcome to Compassionate Conversations.
Thank you, Carlos. Thank you for inviting me.
Now, Sha'Boris, let's get our audience to know you. And would you mind introducing yourself?
Absolutely. Hi, everyone. My name is Sha'Boris Mays. I'm a licensed mental health and addiction therapist, and I do therapy all day. That might sound really odd, but yeah, I do it full time. I do it part time in the evenings in my own private practice. So this is something I'm really passionate about. I'm also a member of the Racine community and the LGBTQIA plus community. So this is something that I love to do.
And a new board member to NAMI Racine County.
Yes, I am.
Congratulations.
Thank you so much.
And thank you for your service to the community. Now, Sha'Boris, despite the fact that minority communities in general present fewer cases of mental illness than their white counterparts in the United States, the U.S. Department of Health indicated that these are more likely to be untreated or misdiagnosed, making the consequences of living with mental illness much more severe and permanent. Mm. So what would you say is the impact of mental illness in the community, and why this difference between minorities and other ethnic groups?
Trust. That's the first thing when I read this question, Carlos, is trust. Trust in the medical field in general. Mm. And it goes back to post-slavery. That goes back to when the LGBTQ was starting to, require rights for their care. So let's think back to, I'm not sure if you're familiar with this, the Tuskegee.
Oh, Tuskegee, yeah.
Yes, syphilis experiment.
Yes.
Henrietta Frank, the opioid epidemic and the people of color communities. Right. All these things are not just isolated events. Mm. So when you're mistreated by people that you think you can trust. Right. If I can't trust you with my body, why would I trust you with my thoughts?
Wow, I guess I never saw that connection, but yeah. So it's interesting because then it gives us the perspective that we need to change that situation. I mean, that we need the public, from the mental health services community.
Yes, absolutely.
To start trusting that we want the best for them. Mm-hmm. Wow.
And judgment is really big too, Carlos. People of color are unfortunately criminalized or judged when they seek out treatment. It's almost presented as if you're attention seeking or medication seeking. It's always like this underlying thing that you're trying to gain from getting these resources versus like, hey, this person is really screaming for help. They need services or, they don't have any place else to go. So why do you keep coming up here? And taking that extra step, like not just what the person is presenting with, but what else can potentially be going on that I can assist them with.
Wow. Okay. So trust will be the very first thing. Mm-hmm. But then within the community, how do you feel the minority communities feel about mental health or a mental illness in general? Mental illness in particular, but but besides the trust, what is the perspective that you feel minority communities feel about mental illness in general? Mm-hmm.
Based on my experience working with people of color, being a person of color, it's not something heavily talked about still, and it's really unfortunate, but it's so much stereotype and biases that goes on with mental illness. It's either you were taught when you were younger, you have to pray through it. There's a lot of religion associated with it.
You
Pray through your problems, or you're just too worried, or when you go to your doctors, take this medication for it, but no one really talks about going through talk therapy or cognitive behavioral therapy, things that will actually address the roots of some problem and teach you skills of how to manage your symptoms.
Wow. And I think that this is common to several groups, in fact.
Absolutely, absolutely.
I'm Venezuelan. This is why I have this southern accent. and so I do know that within the Hispanic community in general, there is certain reticence to mental illness. And I remember growing up, and I'm not saying I grew up with an uncle who lives with mental illness, but there is certain idea of, well, it's our issue. We solve it ourselves.
Yep.
And
what happens in my house stays into my house.
Stays in my house.
But it's out of fear too. Remember, I told you the first thing I said was trust.
Right.
The idea that if I were to tell someone something that's going on, who else gets involved? CPS or Adult Protective Services, all these services that can potentially be a threat to your family. So it's understandable why people wanted to keep it in their household, because okay, now everyone's going to be looking at me. What did I do wrong?
Wow. Okay. Yeah, that's a very interesting perspective. Wow. I guess there's a lot in here that I just did not connect before, and I hope our audience is also making some connections on this.
Absolutely.
Now, so what do we do to try to fight against that? I mean, what are the challenges, would you say, that minority communities actually do face that other communities might not face?
Unfamiliarity, like we were just talking about. If you're raised to pray through things, which is also beneficial, but prayer may also need to be connected with therapy and connected to medication management or medical assisted treatment of some sort. Some community-based programs where it's normalized, even within the churches or the halls. Like, hey, mental health is real. Your mental wellness needs to be something that is addressed regularly and normalized, and not making it foreign, I guess.
Right.
You can be very, very Christian or very, very Muslim and still have anxiety. You can still have depression. It doesn't mean that you don't believe in your higher power. It just means hey, your brain and your body is going through something that needs to be treated. Yeah,
and I guess that there is a point in all of us. I mean, there is certainly, and many of us actually do lean into our spirituality to deal with the pressures of every day. But it's one of the many tools that we can use. I guess we don't have to leave all the eggs on that basket. It doesn't mean anything against that, and it means that it's one big tool and big resource of release. But it's also the opening to other opportunities. What I mean by this is when you lean into your spiritual belief, your theological belief, there is not just you lean on that belief. There is the feedback. There is a need to sort of look at yourself, take a good look at yourself, and evaluate yourself and say, what can I do to do better? Yeah. And mental health is also one of those aspects. What can I do to be better mentally? What can I do to have less stress? What can I do to help with this depression? What can I do? So it's a mirror. It's not just saying, okay, well, pray it away. Because prayer and action actually do have an interconnection, and one thing doesn't go without the other, right? I'm a theologian, so I guess
good for you guys.
I guess this hits.
Feeling the spirit.
Yes, this hits hard, but it is it's not just faith; it's actions.
Yep, absolutely.
And those actions also mean, if I need this help, where do I get that help, and what can I do to get that help, or what can I do to get that help to my brothers and sisters? So again, I don't want to go too much into this, but if that is one of the aspects, and it is maybe our own shame of what mental illness could be.
Or guilt, or feeling like it's a punishment,
Right.
And that's not necessarily true.
Yeah. Well, don't we believe in forgiving our sins? And again, I don't want to get theological on this, but if we feel that something is wrong, we just try to fix it. And if we cannot fix it by ourselves, we look for help for others to fix it.
And normalizing looking for help for mental wellness, or what mental health needs, essentially.
Right. Yeah. Okay. I'm having a little bit of a chat with myself on this, but I think that this one particular thing of the stigma in the community is perhaps one of the most important that for us to fight against and to erase, because it's preventing people from getting the help and that they actually do need, and it does save lives.
Yes, absolutely. And another piece I was thinking about when it comes to challenges is representation. Representation does matter. It's so important to me, being a woman of color in the mental health and addiction profession in general, because let alone a lot of teachers growing up that were African American, let alone doctors, but people that you can relate to, even if it's just having a similarity that we do look alike, in some ways you can empathize with me that other people that don't look like me can't,
Experiences that other people perhaps don't have and that you can understand better.
Yes.
There is a level of empathy. Will you say that representation at this moment is high among minority communities?
No, absolutely not. I can just think that even the clinic that I work for, out of maybe, let's say 12 other clinicians, I am part of 4.
Wow.
Yeah, of people of color, and that is significantly low considering that the population of people of color in Racine is so high.
Right. Yeah, that is true.
Yeah, so it's not just, treating the needs of the clients, but how are we helping different clinicians get the credentials that they need in order to be in the communities that they live in, to service the people that look like them.
Well, okay, so now that brings me to my next question, which is how do we integrate cultural competency into mental health to serve precisely communities, minority communities, from perhaps a shared experience or a level of trust, as you say at the beginning, because we have something in common that might help us. Yep. How do we do that? How do we go about cultural competency in mental health?
I like to think that from the time you meet the client, you're treating a whole person. So your intake assessment, your treatment plan needs to encompass who they are as a person. So acknowledging their ethnicity, their cultural background. So if your assessment that you're doing right now does not ask people about their religious beliefs or their cultural needs, then add it right away, So that way when they're coming to their appointments and they're talking about whether it's religion or traditions in their family, it's not like a shock.
It's not foreign to you.
Yeah, or you're not trying to make it part of their symptoms, if that makes sense.
Wow.
Yeah, because, like, for example, for Christians, they believe in the Holy Ghost. And for Hispanics, sometimes they believe in the Day of the Dead and things like that. So that's not them experiencing hallucinations necessarily. It's just saying, like, hey, this is something I believe in my heart.
I was reading an article that actually spoke to that portion of that some cultural beliefs or some aspects actually can be misdiagnosed as mental illness.
Absolutely.
So that is a very important part, because then asking the question, or at least having some little knowledge of what the cultural background of that very person, of that particular individual might be, it might save us a lot of trouble later on, and it can provide a lot of understanding. And also, again, and I want to go back to this word because I think that this is important. Trust that person can believe that you can work together.
And that's when mandatory trainings come in. That's something else I wrote down. And consistent training. Clients you want them to come in and feel comfortable acknowledging who they are, things that they do on a regular basis, but they should not be your only source of education.
Right.
So if you know you work in a community that's predominantly African American or, Asian American, Hispanics, things like that, you should become familiar with that area. Like, what is more common for the north side or the south side? Where are the people you typically see, like, what's going on in their communities, whether it's activities, whether it's programming, things that you can also refer them to, but also things that you can encourage them to stay away from. These are really, really important. So coming from the safety of your home just to work and not knowing anything in between, that's not really beneficial to your clients.
Right. And so, and you shouldn't have to be a minority to know this stuff, right? You should know your clientele.
Yep.
It's as simple as that. Wow, that is okay. Do you hear my brain exploding? Because it is exploding. Maybe the mic is not getting it, but it is. It's blowing up.
It makes me feel good about my answers because I really put a lot of thought into these because I'm like, this is really important. And I would think about myself if I was being treated.
Right.
Growing up in Milwaukee, I grew up on the north side. Statistically speaking, of the north side of Milwaukee, it's African American dominant, low socioeconomics. And it's like, okay, how does this woman get to the position she's in to be the assistant director at a clinic, having her own business? Like, what path did I take that was differently than other people? I think those are important questions.
Yeah.
So that way, if you meet other minorities or even non-people of color that are going through hardship, you can empathize with them, and you also can reassure them. I had a lot of people in my corner that was encouraging me, like, hey, you're not your circumstances, you're not where you come from, and you can do great things. Sometimes that encouragement is a lot. And we were doing mental health care, and before we even knew what mental health care was.
Right. Yeah. Oh wow. Yeah. Your support groups,
Yes.
your the people around you that
Yes.
are actually helping you. That is important. That's and I think that especially for minority communities, this is almost a natural build. Your family, your friends, your cousins. There is a natural network of support, which then when you bring into the mental illness position or a mental health situation, this is what could actually help you in the future. But it's not enough. I mean, professional help is still needed, especially in certain cases.
Yeah, help can be short term. Like some of the clinics I know about, they have like crisis center. You don't have to commit to like 6 months to 12 months of treatment. Sometimes you could come in for short-term care. Like, hey, I'm going to come for 5 to 6 sessions just to talk through my day-to-day problems. I think that's a big concern, too, where it's like, do I have to sign over everything? Or is this like a significant time consumer? A lot of places are starting earlier and ending later to help people who are still employed and things like that. I know insurance will always be a concern for a lot of people.
Yeah.
But more places are using a sliding scale too. So even if you have to pay a small portion, it's still worth it,
Right. Well, and speaking on this, because you were mentioning at the beginning of the conversation that the inequalities, so social inequalities, actually do play a big role.
Absolutely.
On the. So how do you think they affect the long term? And I actually, again, I was reading this on an article as well, where it speaks about the financial difficulties and concerns, the lack of fresh food in certain areas, the difficulty of having jobs that are well paid. So all these aspects and all this stress actually do affect our mental illness, and this is true for everybody.
It weighs on it heavily, absolutely.
So in minority communities, and this is another point of the article that I had not thought about before, but it was interesting to me. And it says, especially with minority communities in big cities, where probably live in areas that are, poor areas, and in the case of immigrants who actually are immigrating, and most of them don't have a job, don't have a place to go. So these aspects actually work against our mental health.
Yes.
There's this one aspect that, and you just mentioned it, the insurance part. So if you don't have money, if you don't have food on your table, or you don't have a place to sleep, insurance is your last
concern,
right?
Yeah, absolutely.
So how do you think these things actually do, or what role do they play? And I guess I answered the question myself, but what role do they play on the long-term mental health of minority communities?
Okay. Yeah, that is a really good question. I know something I like to think about is mental health. For some cases can be acute, and in a lot of cases it grows gradually. Like something you were just saying, like, hey, if you come to the United States and you're an immigrant, the chances are you were probably uprooted from your living situation. So that's like one strike against you. You get to this new place, you may not know many people, that's another strike. So all these things are weighing on your mental wellness that can probably cause anxiety, depression, hopelessness, And once those things start, and there's nothing to disrupt some of that pressure.
Right.
That early intervention, like crisis care or case management, if those things are not implemented, it goes from being mild symptoms to moderate symptoms, and it can eventually go to severe symptoms where, like they say, from short-term to long-term mental health concerns. And you only can put so much pressure on your brain, and it will change. It would change how it looks and would change the chemical balance in it. And it can shift your quality of life as well. So early intervention is definitely important. And I hear what you're saying with the lack of ability to pay, but a lot of counties have county-based, mental health services. So if you go there and ask for help, they should be able to give you some resources. Or even if you have to add yourself to a waiting list, get involved with those. I know a place like, for example, NAMI Racine, we have those peer support groups.
Right.
Something to release some of that pressure until you can get the long-term care. It's taking the necessary steps you need to, mental health wellness and a better quality of living.
That's actually a really good point. And this is, NAMI Racine County does provide support groups that actually, and all support groups in NAMI National are free of charge to the participants.
Good.
And they're precisely for that. They don't replace therapy, but they help you alleviate the pressure while you are doing therapy.
Yeah.
And I think one of the facts that our support groups are led by peers, by people who are actually living that experience, provides that, again, I just, this is going to be my word for today, that level of trust.
Yes, absolutely.
Of knowing that we have a shared experience, and that the slogan, our phrase, and what we believe, that you're not alone, that you are walking with other people, and you can be successful even if you're living with a mental illness. It's not, it doesn't define you.
Yeah, absolutely.
It's something that you have. We have our outreach coordinator always says, like, my mental illness is not even in the top 10 things that are cool about me. And
I like that.
Yeah, I love that, because it's not, it doesn't stop you in life. It's something that you live with.
Yep.
But you live with and many other things. And I think, and this, leading to my next question, is that we do have this horrible stigma about mental illness, and it has diminished in society in general, but among communities of color and minorities, there is still high stigma.
Yeah.
And there is still this belief that that mental illness defines you.
Like everyone is crazy.
Right.
Like you can't diagnose someone with crazy.
Yeah, right.
Just
yeah.
so you know.
So I don't go to therapy. I'm not crazy. Or I don't. I don't want to do this
I'm not
because
going to
people
talk about
are
my problems.
Right. So how do we help minimize this stigma in our communities? Because again, this is what I believe stops a lot of people from seeking treatment, and unfortunately, this again costs lives or can ruin a life for somebody. So what do we do to address this stigma among the minority communities?
It's acknowledged that therapy is a form of treatment. It's different in some capacities, but just like if you were getting treated for a cold, if you were getting treated for, diabetes or cancer, this is something you will really run to the doctor to get treated. And that's the urgency we need for mental health. And I like to explain to everyone that we all have mental health, but how we take care of our mental health needs is like the clarifier right there. You can have either a mental health issue, or you can have a mental health episode, or you can have a long-term mental health illness, but we all have some form of mental health needs.
Right. Yeah. We all go through some kind.
Yeah, absolutely. So advertisement. I like everyone is on social media all day, every day. So advertisement, whether it's a little meme, a little catchphrase, like, hey, did you check in with yourself today?
Right.
Or did you encourage yourself? Check on your friend. I love seeing those little posts, when I am on my social media websites. I notice when I go to the doctor's office lately, I'll see the crisis helpline, the suicide prevention helpline. I'm like, what? I remember going to the doctor younger. I would never seen that stuff around, posters around the community. I think that's eye-catching, where people can discreetly reach out if they wanted to. You can text message if you don't have a smartphone, having it be available to multiple people on the same platforms.
Right. That's the 988 support line.
Yep,
and it's not, you don't, it is very private, and you can actually talk to somebody, to a professional right there, without having to go anywhere else.
Yeah.
And this is important. I want, again, to repeat it for our listeners. This is 988, and it's a crisis support line.
Yeah.
It's different to 911. It's not the same. It's for people who are going through a crisis, a mental health crisis. So write that down, because if you need it, it's a very good resource to have.
Yeah, and 211, if you were to call them too, they can also connect you with other mental health or addiction care services as well, even for the LGBTQIA, community. It's definitely a lot of resources out there 211 does have.
And that's the question I asked you before. So when it comes down to the LGBTQ community, and we just had our previous episode was precisely on pride and the particular issues that the LGBTQ community goes through because of social pressure and so on. In the case of minorities who are part of the community, what is, and I don't know if you have a number or an idea, exact idea, but what would you say is the most pressuring mental health issues that go through communities, especially, because we're adding the stigma of mental health that is already prevalent in our minority communities, and also you're having the social issues that being part of the community bring to it. So what would you say is and how do we reach out to them? How do we reach out to people who need help because of all these stocking elements? Yeah.
I would say isolation is one of the main concerns. I'll just get through it myself, or I'm not going to tell anyone. I'm doing quotations because, coming out of the closet is more difficult for some people than other, especially with their network people. If they don't know or they're not comfortable with it, it's like, how do I get the space to do that, And we have HIPAA requirements, so if you were to talk to a helping professional, they're not going to out you or anything like that. So that's definitely something you can look into. It's a lot of anonymous groups to do the LGBTQ centers in Racine and Milwaukee, where you can go to groups or you can talk to a mental health professional, and you don't have to disclose any private information about yourself if that makes you comfortable. So there's resources where it's steps.
Right.
That's something I definitely wrote down is psychoeducation, putting it out there to people in ways where they don't feel like, it's too vulnerable for me, where I have to take the step back, where I'm just too afraid.
Right. Wow. Okay. Psychoeducation. I like another word that I'm going to write down for this episode. Now, how in the case of mental health professionals, how can they address the intersectionality of race, ethnicity, and other identities when treating minority patients? And you mentioned something before that I thought it was key, and is the part of get to know the person. Yeah. So get to know their background. But it occurs to me, it's also do not assume.
Yes, absolutely. Like, I'm a person of color, you're a person of color, but our interpretations of the world can be totally different. Right. And it might be things that we are really passionate about that are alike to, you know?
Right.
So going through those questions, it's not just to know where they come from or what they've been through, but it's to find those commonalities too, so you can build on that. That creates trust, that creates rapport. That makes me think like, hey, when I'm coming to the appointments, that, hey, no matter how far out the comments I make or jokes, it's not just taken as, oh, you're having a mental health episode, but I can see the human in you. You know, I can see your challenges, but let's try this, you know. And I want you to go home and try these coping skills, these strategies, and you come back and you tell me how did it go. Wow.
Which is, again, building trust between one and the other, knowing that we are here together, you know, walking this path.
Yep.
Wow. Well, thank you for this conversation. I mean, this has been eye-opening in many ways.
Yes, thank you.
And before we close our episode today, is there anything else you'd like to share with our
Yes, please.
listeners?
Just a couple more points. Acknowledging race does matter. I think that's a big thing. Some people like to say, like, I don't see color. But when you say things like that, you're saying you don't see that person, you know, because we are... A big part of who we are is our ethnicities. Yeah. You can't look at a white person. Somebody might say I'm Irish. Somebody might say I'm English. So I don't want to, like you said, I don't want to make those assumptions. So what does that mean for you? And to be honest about your lack of knowledge. Like I mentioned earlier in the conversation, it's not meant for the clients to be your only source for education, but it's okay for them to explain their interpretation of being a part of a church community or their interpretation of being a Racinian, you know?
Oh, right. Yeah. All those different aspects that kind of hit you in different ways. And they somehow shape your own perspectives about yourself and the community that you live in.
Yeah, because if you start asking yourself questions, you uncover your own biases, your own stereotypes, and start to begin to really do the work of holding yourself accountable for how you treat people.
People are people, after all. Isn't that the truth? But you know, there is the beauty of the different, and I think as long as we can embrace that beauty. We can just appreciate the differences as something that unites us more than something that separates us.
Yes, absolutely. That was really beautiful said, Carlos. That's nice.
Thank you. I've been practicing these days.
Good for you.
Well, thank you. Thank you again very much for this. And thank you for serving on our board. And thank you for all you do for the community.
Thank you.
And, you know, thank you for being part of our compassionate conversation.
Anytime.
Well, thank you to our listeners. And this has been Carlos Freight with Sha'Boris Mays. Until our next compassionate conversation.
Take care.
Compassionate Conversations is brought to you in a partnership with United Way of Racine County. Thank you for your support. NAMI Racine County is a local affiliate of the National Alliance on Mental Illness. Our vision is to create a compassionate community where all people affected by mental illness live healthy, fulfilling lives. NAMI Racine County provides advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can build better lives. Visit us at www.namiracinecounty.org for more information on mental health and related activities.